Hello, everyone, and welcome to our next People in the Spotlight session. Today, we are meeting with Dr.Rose Nanyonga. She's a well-established inspirational healthcare leader, educator, learner, researcher, nurse, mentor, policy influencer, and global health enthusiast. Rose has more than 26 years of clinical nursing experience and health systems and administrative leadership. She's the current Vice Chancellor at Clarke International University in Kampala, Uganda. It wasn't always an easy route for Dr. Nanyonga, and her work today is evidence of her fierce commitment to paying it forward. Though she says she didn't have examples, encouragement, or confidence, she said she paved her way to leadership roles, and now she mentors young women in the nursing profession. Welcome, Rose.
Oh, thank you very much, Rebecca.
Thank you so much for having us. Thank you. Thanks so much for coming on our People in the Spotlight session. I've given you a bit of a, you're welcome. I've given you a bit of a brief introduction, but I was wondering if you could give us a bit more about information about your early career and what made you first attracted to nursing.
Oh, thank you very much. I started my nursing career actually from what we consider now the lowest level of training. I didn't really have an opportunity as a teenager to remain in school to pursue mainstream pathways for education. Because my family was very much disrupted during the early wars of 1980s. My education was very much disrupted thusly. So I started my nursing career as a nursing aide. That was actually my first training opportunity and training certificate. And the inspiration for me, which I'm sure it's common for many nurses, that my early passions for nursing and midwifery were born out of tragedy. For me specifically, my mother, who was actually a nursing aide as well, was having her 9th child during the war. I was barely 8. This is almost 40-something years ago.
Yeah, wow.
And she died while having her 9th child. Wow. And the baby died with her. And so that really spurred me on because I was determined to plug a gap and to try and contribute to the efforts to to reduce maternal mortality, to make sure that the next woman had a nurse at her side or had a midwife at her side. So those were really my early passions for nursing and midwifery, were very much driven by this family tragedy for us that was very, very personal. Of course, I've made this my career now. What drives it beyond those initial feelings are things that I've learned along the way and so on. And so, yes, so the moment I had an opportunity to train, even if it meant me becoming a nursing aide, just like my mother, I took that opportunity, and then that established minimum foundation that eventually I used to pursue additional training, to get a certificate, and to then escalate that much later on when I had an opportunity to go to the United States to secure a nursing degree, a master's degree, and finally a doctoral studies at Yale University in Connecticut.
Wow, that's such a journey. Thank you so much for sharing that with us. That must have been really, really difficult, and amazing that something positive has come out of it, but I can't imagine that at the time. Wow, that is a lot.
Yeah.
And now, could you tell us a bit more about the role that you're in today and how you got into it?
Now I'm no longer a bedside nurse, of course, but I'm still passionate about educating nurses, educating midwives, and other healthcare providers. So currently, I'm an educator. I work as an associate professor of nursing, midwifery, leadership, management, and policy. And I'm also one of three actually in the country, a vice chancellor for a private university here in Kampala. It's a fairly niche university. We focus on health sciences, and we train nurses and midwives, clinical officers, other allied health programs, public health, and business and applied technology. And I spend majority of my time, of course, as an administrator of the university. It's the vice chancellor here is the equivalent of a president of the university. So
Okay.
It's big shoes to fill, and
Yeah.
I am up for the challenge.
Amazing. Yeah, that sounds like you would be a very busy woman, I think. Do you miss working at the bedside at all?
Not anymore, actually. I worked as a nurse for many, many years, as a critical care nurse specialist, as a generalist, earlier as a midwife, which didn't last long. I knew that I couldn't be a good midwife. But I enjoyed being a nurse very much. In 2005, when I first finished my master's degree, my graduate studies in the US, I returned back to Uganda, and I was asked, in collaboration with a local organization here, I was asked to establish a school of nursing to train nurses. And that really put me on a path beyond the bedside nursing. At the time, my job was the director of nursing services for International Medical Group here in Kampala. So I was already doing a lot of admin work. And so I started working with other people to develop curricula to train nurses. At the time, International Hospital Kampala were facing a lot of challenges with the pool of nurses that they were getting. They were trying to establish international standards, and that was a challenge. So the CEO of the organization thought if we trained our own, we would probably be able to raise the standards of training. So that put me on a path. So since 2005, I started working less and less on the bedside, and I increased my involvement in training nurses and midwives instead. I kept my license, of course, because I firmly believe that, you know, we have to know what is happening in practice to be able to teach properly. And to link practice to theories. And sometimes I think educators are so blind to what's happening in the hospitals and in the care practice environment that we are not able to train a workforce fit for purpose. So I do go into practice routinely, but not as much as I used to do.
Amazing. Yeah, no, I totally agree. I think it's so important to still have that foot in the door when you can. I think it's sometimes very difficult when you're doing so many roles, but even just, understanding what's happening on the floor, because it changes so often, doesn't it? And it's an ever sort of changing environment. Can you tell me a little bit about some roadblocks or challenges that you faced along the way in your career and how you overcame these?
I think, a lot of my challenges were very much related to the fact that I didn't pursue mainstream pathways for my training and for my education. Of course, I did get onto the mainstream later on when I started my bachelor's degree. But the fact that I started as a nursing aide, that was really an uphill battle. getting from there to getting to the PhD. And I'm aware that my challenges are quite common for a lot of nurses in sub-Saharan Africa. For example, in Uganda, over 70% of the nursing workforce, which is close to 100,000 registered, probably about 70 of those with current licenses, 70,000 of those with current licenses. But over 70% of that workforce are at an enrolled nursing certificate.
Wow.
So it's very difficult if you want to progress such a workforce into making, for example, a bachelor's degree, as has been recommended by various international organizations. If you want to enhance their learning and progress their career to become bachelor's degree nurses, it's going to be a challenge. So starting at these levels presents, of course, opportunities for advancement, but countries have to be a lot more intentional to support nurses, like I was supported. Funding for education is a challenge because your salary at that level is so low that you are not able to actually self-fund to pursue additional training and education. And sometimes we don't have, as like I didn't have an enabling education environment because mainstream education, the entry requirements into the programs are very much targeted to secondary school leavers and so on. And sometimes nurses with these certificates or lower qualifications are simply not recognized within that mainstream. So those are challenges I faced myself, but I'm sure that they are the same challenges that the nurses and midwives face on the continent.
Yeah, wow, and I think it's really good to highlight that too. You know, all the different ways that you can get into nursing. It's not always sort of, you know, black and white, but I think that it's great to hear that you started as a nurse's aide and now you look at you like you're a massive leader in nursing, and that's like such an inspiring story, or you know, for everyone.
Well, thank you. But also, Rebecca, the other issue really, I think for me was, you know, finding champions and mentors very quickly at that stage. Even when I started working, of course, as a nurse, bedside nursing and so on, I knew that I wanted to be an administrator. I wanted to escalate my career pathways along those lines, to leverage my talent and my skills, not just for caring for patients, but you know, to pursue advocacy, for example. That's one of the things I do, and I do well, and to become a nursing leader, to represent the voice of nurses and midwives. But I think one of the challenges along that career path for me has always been, you know, the lack of accessible champions and mentors, you know, who can really say, hey, you can do this, or we've done this before, we know it's possible, and here are some strategies to navigate the complexity of that. And the disadvantage that nurses and midwives often have when they become leaders, that one of the things that I typically say is that sometimes we say, you know, we need to get to the table, but then sometimes you get to the table and you still aren't able to be a productive contributing member of the team at the table. So how do we enable people to really be productive leaders at every level of their career path, whether it's at the bedside, whether it's in the boardroom, and so on. So I think that's a critical challenge that I thought is, you know, worth mentioning.
Yeah, I think that's a good point, and it's actually a theme that comes up a lot when we're having these sort of people in the spotlight discussions about, being at the table, but not still maybe not having our voices heard the way that we would like to have them heard, or represented the way that we would like to have them represented. So I think that's a really good point. And this group is all about future leaders and empowering our future nursing and midwifery leaders. And your career, like you've just sort of touched on, has had a big focus on leadership. And we know that sort of around the world and for different people, leadership means different things for different people. So what would you say leadership means to you? What is being a good leader? It's a bit of a complex question.
Yeah. Well, when I did my dissertation, I actually focused on James Courses and Barry Posner's school of thought for transformational leadership. They talk about these 5 practices of exemplary leaders, modeling the way, inspiring a shared vision, challenging the process, enabling others to act, and encouraging and celebrating others, encouraging the heart and celebrating others. So I think for me, my personal best is when I know that I'm living these disciplines in demonstrable ways as a leader, that I'm living these disciplines every day in my role, whether as a nurse, whether as a vice chancellor, whether as a professor, that I'm able to model the way for others, to inspire a shared vision for nursing scholars or clinicians and others, explore opportunities to challenge the process and inspire innovation and transformation, which we ardently need, of course, in practice environments where we work. Enable others to act, whether through lobbying for investment, or for education, for practice environments that are enabling nurses, for safety, for resources that they need, PPE, for example, during COVID. So I think my personal best as a leader, that's what it means for me, to those 5 disciplines, and living out of those in demonstrable ways.
Yeah, that's great. And I know especially post-COVID, there's many challenges in the nursing and midwifery profession, and you've touched on some of them even just there, finding adequate PPE. But what do you think are some of the biggest current major challenges that we're facing?
Rebecca, we had an opportunity recently in Uganda. We just celebrated the 100-year of nursing and midwifery, particularly regulation, 100 years of regulation of nursing and midwifery last week. And at that event, I was asked to deliver a keynote about the future of nursing education and practice and implications for regulation. And I did touch on some of the intractable challenges that cut across countries. These are challenges that globally we've talked about. The WHO put out a report, the State of the World Nursing Report in 2020, and talked about some of these. So these are really key. And one of them is we really need to bolster nursing and midwifery strategic leadership. We needed to build capacity. We know that leadership is a key enabler for health system strengthening. And we need to be more intentional in investing in that, and whether it's nursing faculty, whether it's nursing supervisors, whether it's young nurse and midwives who are aspiring to become leaders, and be more intentional in including that in traditional regular curricula to enhance leadership. When I was becoming a leader, and I'm sure it was true for you as well, you just had to learn on the job. You had to learn on the job. And I remember I had a supervisor who once told me that, you just fake it until you make it.
Smoke and mirrors, I get told.
Exactly. And I thought, well, I don't want to fake it, you know, until I make it. And how long do you stay in that fake lane? So
Yeah.
I think that's a critical enabler that all nursing leaders really need to be more intentional, and we need to lobby for resources to ensure that we have strategic leadership. Innovative curricula is really important. As I mentioned, in Uganda, for example, transitioning from vocationally trained nurses and midwives, who are the majority, to getting them to basic higher degrees requires innovative, enabling curricula, and we need to look at, okay, what is that going to look like? What kind of nurse do we need for now and the future? And does the current curricula enable the education we want to see? And the WHO report also really mentioned this is very critical, investing in education of the nurses. We've had chronic underinvestments, and majority of nurses and midwives don't earn enough to enable themselves, to pay for themselves to go back to school and pursue doctoral studies, for example. If we want more PhDs. In Uganda, I think on the registry, we have only 2 nurses with PhDs.
Wow.
Some others are not registered, but I think the number in total is less than 15 so far.
Wow.
So beyond 100 years, you know, at the century, as we celebrate a century of nursing and midwifery, we still have less than 4% of our nursing and midwifery population with bachelor's degrees, and 0.00000% of PhD.
Jeez. Wow.
So we needed to invest in education, the education of nurses and midwives. We need enabling regulation, and that includes the capacity of the nursing and midwifery regulators in our countries. Needed to be looked at. And then the other issue really are critical shortages of nursing faculty, critical shortages of learning resources, critical shortages of productive capacities of training institutions. These are all the things that I mentioned in my keynote last week. And then finally, we need to enable the safety of nurses and midwives, their well-being, their welfare, their compensation and benefits. I remember last year, we kept talking about how applause is not enough. And that is really true. This is a challenge every nation, every country must take on, but the welfare of health workers in general. But of course, for me, I'm a champion for nurses and midwives. The welfare of nurses and midwives is something to which budgets must be committed, specific budgets must be committed to enable nurses and midwives to practice in environments that allow them to thrive and do the best that they can with the talents that they have.
Yeah, 100%. I could not agree more. That's an excellent answer. Thank you. Thank you so much. We have a question here from Doris. She's a third-year nursing student from Mombasa University in Uganda. And they're just wondering, what do you think is the main reason for shortages of equipment, especially in government hospitals, and how best can it be addressed? This may not have a very basic answer, I'm sure. I'm sure it's based on many things, but
yeah.
Have a go.
Well, I mean, we do have a lot of system-wide challenges, health systems challenges in the country, and I'm aware that if you're looking at those building blocks that we've been talking about for many years now, that, you know, the supply chains in the country do not work as adequately as they should. But I think for me, I don't know that I have a direct answer as to what needs to be done about the equipment. I think that we needed to consider how linked these problems are. It's simply not just a problem about equipment. It is a problem about a system. And we need to look at how linked the issues are, from having adequate resources to deploying those resources appropriately, to utilizing those resources appropriately, to having persons with the capacity to do appropriate planning, to manage supply chains, to manage stockouts, to have systems, including information technologies that can enable us to anticipate some of these shortages within the system, and then diverting resources to where resources need to be. And having accountable systems. Sometimes it's not really a matter of, I know we talk a lot about corruption, but sometimes it's really not a matter of having a lot of resources. It's being accountable with the resources that we have and using those resources appropriately. But there's a great deal of system learning and system efficiencies that we needed to see in our healthcare systems in Uganda. And it has to do, yes, with the equipment, but it also has to do with everything else that goes with that, the human resources, and so on, and the investment and the utilization of those resources, as I have said. So probably not the answer that she's looking for, but that's the answer I'll have for today.
Yeah, thank you. And then just our last question, one that we like to finish on all the time with our guests, is given what you have learned in your career and the experiences that you've had, what advice would you give to your younger self?
I think I would say, have a little more faith, have a little more confidence. Everything is gonna be okay.
I like that.
I think that when I was a nursing aide, for example, I had skills, and I was passionate and very, very committed. Very smart nurse even then. But I wasn't as confident because I think we put a lot of stock into qualifications and titles, and ignore the fact that people can be extremely talented even without a title. So
Yeah.
I would say to my young self, just be the best that you can be right where you are. Have confidence in what you're doing.
Amazing. I think that's some great advice to lead on. Thank you so much, Rose. It's been such a good chat. I feel like we've covered a lot of topics. I feel like I could talk to you for hours, but unfortunately our time is up. Okay. For anyone who would like to continue this chat, or if you had any more questions for Rose, she is part of our Nursing and Midwifery Global Community of Practice. So please comment below, write some questions, and I'm sure she'll get back to you. And also, if you have a look at Rose's bio on our platform, she's put some excellent links to different leadership things that she's been involved in. There's some webinars up there and really great educational materials, so please go and have a look at that. I'll post the link again below, so you can check that out because it's some really great resources. And we'll see you next time on our next People in the Spotlight. Thank you so much.
Rebecca.